Well, back in 2007, 2008, maternal health was starting to become more prominent on the global health agenda. But part of the problem was that there were disagreements within the field about what the priority action should be. And there really wasn't at that time a neutral place for both technical experts, programmatic experts, and policy experts to sit down together and come to some agreement. So the Gates Foundation decided to create the Maternal Health Task Force, partly to create a space for that to happen. So we have been doing that for the last 3 years or so, and one of the ways in which we've provided fora for discussion is through our partnership with the Woodrow Wilson Center and UNFPA. We've had a dialogue, a series of maternal health policy dialogues that have been going on for about 2 years now. And we've focused on neglected and emerging issues in maternal health. And I think we've really managed to bring up some topics and bring in some experts that normally aren't part of these discussions to bring the perspective of other fields. For example, we had a 2-day meeting here, partly with a public dialogue and partly with a private meeting that was on transportation issues in maternal health, which are a big issue. One of the big barriers to women getting to maternal health services is lack of transportation. So we brought together both maternal health experts, but also people from the transportation sector who quite often don't speak to each other. And it was a very interesting meeting. It was, I think, a meeting of the minds in some ways, and I think we had a really good result. Part of our mandate is to bring in the perspective of what we call allied fields. So the example I just gave you on transportation and maternal health, we also did a policy dialogue here on the integration of services, HIV/AIDS services and maternal health services. So we brought together people who are working in HIV/AIDS and who are working in maternal health, and those two types of services should really be working together and be integrated, and it doesn't happen very often. And the question is sort of how to make that work. We've also done, for example, some work on water, the relationship between water and sanitation and maternal health. We have a series on our blog, which is quite a popular blog now, on water and sanitation and maternal health. So we're constantly trying to push those barriers and look for interconnections between different development sectors with maternal health.